Hi, my name is Taylor Boone. In this video, we'll review the integumentary system. First, we will review the definition and function of the integumentary system. It is most easily defined as your skin, and it is the most accessible organ system, making up 16% of a person's total body weight. The integumentary system is the body's first line of defense against the outside environment and protects the underlying tissues and organs within the body. There are two main parts of the system. First is the cutaneous membrane, which is comprised of the epidermis and dermis, and second, the accessory structures. The accessory structures include the hair shaft, pore of sweat glands, Meissner's corpuscle, sebaceous glands, erector pili muscles, sweat gland ducts, sweat glands, hair follicles, lamellar corpuscles, and nerve fibers. The functions of the integumentary system include protecting underlying tissues and organs against impact, abrasion, fluid loss, and chemical attacks, excreting salts, waters, and organic wastes by integumentary glands, maintain normal body temperature through either insulation or evaporative cooling as needed, produce melanin, which protects underlying tissue from ultraviolet radiation, produce keratin, which protects against abrasion and serves as a water repellent, synthesize vitamin D, which is a steroid that is subsequently converted to calcitriol, a hormone important to normal calcium metabolism. Store lipids and adipocytes in the dermis and in adipose tissue in the subcutaneous layer. And finally, detect touch, pressure, pain, and temperature stimuli and relay that information to the nervous system. You can see those listed here in the image to the right.
Hi, my name is Malia Proveaux. I'm going to begin by talking about the components that make up your skin. Although it seems simple, the integumentary system has a complex anatomy. The skin has three layers: the epidermis, dermis, hypodermis, and several accessory organs such as hair, nails, and various glands. These layers collectively are called the cutaneous membrane and make up the largest organ in the body. The outermost layer is the epidermis and derives its name from the Greek words epi, meaning over or upon, and derma, meaning skin. The epidermis is continuously making new skin cells from stem cells that are located at the basal layer, which is the bottommost layer. These cells are pushed to the surface and eventually shed. The epidermis has an average of 40 to 50 rows of cells that are tightly packed on top of one another. The epidermis is avascular, meaning it does not contain blood vessels. This is why superficial scratches do not bleed. The epidermis is around 0.5 to 0.8 millimeters thick. The skin on the palms and soles have a fifth layer, and its individual layers are thicker than those of the rest of the body. Here are a couple of pictures to demonstrate some of the main differences between thick and thin skin. Under the epidermis is the dermis layer, consisting of dense irregular tissue, nerve tissue, and blood vessels. These irregular tissues are called collagen and elastic fibers. They allow the skin to be stretched and provide strength. The third layer, called the hypodermis, is not actually a component of the skin, but rather is a layer of adipose or fat cells and flexible connective tissue that separates the skin from the tissues underneath. The hypodermis is also referred to as the subcutaneous layer. It allows for movement of the skin while providing strength, support, and anchors the skin to the body. The dermis has glands that produce important secretions. These glands are the sudoriferous, sebaceous, and the ceruminous glands. Sebaceous and sudoriferous glands are also known as sweat glands. They help in the regulation of body temperature, rid the body of waste products, and lubricate the skin. Not all sweat glands are alike. Glands found in the armpit, pubic area, and around the nipples are apocrine sweat glands. These glands secrete a thick, oily substance at the hair shaft. This oil is consumed by bacteria living on the surface of the skin and is responsible for body odor that is caused by sweating. Merocrine sweat glands are located on nearly the entire surface of the skin, with the highest numbers on the palms of the hands, soles of the feet. The merocrine sweat glands' function is to secrete a watery substance that is quickly evaporated off the surface of the skin to reduce body temperature. Ceruminous glands are only located in the ear canal and release a waxy substance which is responsible for trapping foreign objects that get into the ear canal and to lubricate the eardrum. For your reference, here are some pictures of skin glands, their location, and orientation to other organs of the skin.
Hey, this is Kristy Hege coming to you live from Mount Airy, North Carolina. There's been complaints by the locals stating that their hair's become ultra frizzy and fast growing due to the extreme heat and high temperatures. Well, let's just go over what the normal hair is supposed to look like and do. As you can see, that the hair grows from a bulb that lies very deep into the skin layers in a yellow area that kind of looks like fatty tissue. But as the hair comes up, there's a connective tissue sheath that surrounds the cells of the hair follicles, and it comes up through the hair root. The hair root anchors the hair to the skin, and as the hair shaft loses its connection with the walls of the follicle, it comes up through the skin, known as the hair shaft. This is what is visible on our bodies. And did you know that 75% of them are on the general body surface of our bodies and not on the head? And the human body has about 2.5 million hairs. There are two different types of hair on our bodies. Terminal hair, which is that coarse, dark, pigmented hair that's found on the scalp, the armpits, and facial hair of men. And then the vellus hairs are your smaller, shorter, more delicate hair found on the body surface. So I've had many locals up here in Mount Airy, North Carolina, ask me what the purpose of human hair is. They just think that it's just in the way and makes them hot and sweaty during these high temperatures and humidity. Well, I told them that the main function of human hair is for insulation, and that helps to protect our skin, and it's a friction buffer. So as we sweat, especially in the armpits and other places of skin-to-skin contact, if that hair wasn't there, there would be a lot of friction and a lot of skin burn. And also, our hair regulates our body temperature. So thank goodness for having hair on our bodies, because it also protects our eyes when we sweat. So don't forget about those eyebrows. Ladies, don't pluck too heavily in this high heat and extreme humidity. You'll have more sweat in your eyes than you can handle. Hi, this is Kristy again. There's also locals in Mount Airy that is complaining of their nails turning this yellow color and kind of looking brown in this high heat and humidity. Well, there's a possibility of moisture, extra moisture getting under the nails, causing our fingernails to lose that nice pink color that the nail body should have. So that nice pink color is caused by numerous blood vessels that are underneath that nail bed. Well, nail production occurs at the nail root. So that's the deepest portion of the nail roots, very, very close to the bone of our fingernails. And the lunula is that white crescent moon shape that you see on the nails. So any moisture sometimes that's get underneath our nails and it can't be released, that just builds and builds and builds and can cause some fungus. So our nails say a lot about our health. So it's very important to pay attention to what's going on with our nails. And did you know that keratin is a hard protein that is found in our nails? That's what our nails are made out of, and it lies on the nail bed. And like I was telling you about the blood vessels that give our fingernails that nice pink rich color, that's normal. That's what you want to see. And nails that grow from a matrix of active cells beneath the fold of the skin called the cuticles and from the lunula. So people want to know, well, what's the purpose in having fingernails? What is their function? So I go and tell them that our fingernails help us pick up small objects. So could you imagine trying to pick a penny up off of a slick table and not have fingernails? It would be hard. Our nails also protect our digits, the very, very ends of our digits. They protect them and they guard against injury. So think about how many times we squish our fingers in a door jamb or on our books as we're trying to pick them up and they land on our nails. If we didn't have those nails to protect the tips of our fingers, we would be injured a little bit more seriously. Not only does the nails do all those, but they improve our fine touch sensation and used to scratch those pesky mosquito bites that we tend to have this time of the year because of the heat and the humidity. And as I've talked about before, the look and the shape of our nails can tell a lot about a person's health. So pay attention to those nails. So the good and the bad of nails. Nails that have ridges, most of the time is caused by aging. As we get older, we lose that nice, smooth texture on our nail bed and start getting these ridges. But discolored, thickened, and split nails can be a sign of mineral or vitamin deficiency, and a person should seek medical attention. Nails that are shown in the right of the pictures is caused by fungus. You should also get some medical attention for that as well. The nails on the left-hand slide of the show is what a healthy nail should look like. So as we are reporting live from Mount Airy, North Carolina, just hang on tight because this high heat and humidity is going to last us a little while longer. Thank you very much. Bye.
This is Heather Eager, and up next is skin cancer. Skin cancer is the most common type of cancer. Basal cell carcinoma is the most commonly diagnosed type of cancer. This occurs from overexposure to UV radiation and sunlight. Tanning beds can also cause this type of cancer. Many survive this type because it does not result in metastasis. The most fatal type of skin cancer is known as malignant melanoma. If it's not caught early enough, the survival rate drops to 14%. However, if it is caught early enough, the affected area can be removed and the 5-year survival rate increases to 99%. Shown on the left are several types of skin cancer and what they could look like. It is important to see a dermatologist once a year to ensure that you don't have any new spots or moles that have appeared since your previous examination. If so, you could have a form of skin cancer and need to have it removed. On the right are the layers of the skin that are affected by the different types of skin cancer. Next up is burns. When an individual obtains a burn, the functions of the integumentary system are compromised. Which systems affected is dependent on the severity of the burns. The main focuses during burn treatment are replacing lost fluids and electrolytes, providing sufficient nutrients, preventing infection, and assisting tissue repair. Oftentimes, a skin graft is necessary if a third-degree burn occurs. If a burn causes significant damage to a large area of skin, it could lead to dehydration and electrolyte imbalance, which then leads to kidney impairment and circulatory shock. Severity depends on the depth of penetration and the total area affected. Burns are categorized into 3 different types based off the severity of the burn. They're called first degree, second degree, and third degree. For the first degree, only the surface of the epidermis is affected. A sunburn would fall into this category. The skin can become red and tender, a condition called erythema. For a second degree, the entire epidermis and some of the dermis are damaged. The skin blisters and becomes swollen. Pain is associated with this type. Accessory structures are not normally affected. It normally takes 1 to 2 weeks to heal from this type of burn, and scarring and infection are both possible. A third degree burn is also called a full thickness burn. The epidermis and dermis are affected and could also extend into the hypodermis. They are not normally painful due to the nerve damage that occurs. Pictured are 2 different ways to demonstrate the different layers of the skin that are affected with each type of burn. Burns that cover 20% of the skin's surface threaten critical homeostatic functions of the skin. The functions that can be affected by burns are fluid and electrolyte imbalance, thermoregulation, and protection from infection. When a patient suffers from a burn, they are evaluated by the percentage of skin that has been burned and the depth of the burn. The percentage of the skin affected is determined by the rule of nines. The rule of nines is a method that divides the body into surface areas that are divided by multiples of 9. It should be noted that children are evaluated differently since their proportions are not the same as adults. A pinprick is utilized to assess the depth of a burn. If there is no reaction from the patient, then it represents a third-degree burn. This is because there is loss of sensation due to nerve damage. Next up is other common skin conditions. Eczema, which is also called atopic dermatitis, is a condition that makes your skin red and itchy. It is considered a chronic condition characterized by episodes of flare-ups. There is no cure, but there are treatments to help maintain the symptoms. Vitiligo is a condition that's characterized by white patches that develop on the skin. Any area of the body can be affected. Those with a darker toned skin have this condition stand out more because the patches are white. Why this condition occurs is still being researched, but it's thought to be an autoimmune disease. Once the white patches occur, it is rare for pigment to return. Psoriasis is a condition that consists of skin cells that multiply up to 10 times faster than normal. This causes bumpy red patches covered in white scales to develop. These patches that develop are called plaques, and they can be itchy and painful. There is no single known cause for why this condition occurs, but is thought to correlate with a dysfunction of the immune system. Pictured here are examples of the 3 skin conditions I just described. The symptoms of eczema are itching, which may be severe, especially at night, red to brownish gray patches, which appear on various areas of the body, small raised bumps, which may leak fluid and crust over when scratched, thickened, cracked, scaly skin, and raw, sensitive, and swollen skin from the scratching. For vitiligo, the skin doesn't have its characteristic color because it has lost its melanin. For some reason, the pigment-forming cells known as melanocytes have been destroyed. For psoriasis, Kim Kardashian, her mom Kris Jenner, the golfer Phil Mickelson, Leanne Rimes, and Jerry Mathers, who was the beaver on Leave It to Beaver, all have psoriasis. Thank you for listening to our presentation. The next couple of slides have our references.